My name is Paul Guyler. I'm the lead stroke consultant at Southend Hospital. I moved to Southend in 2007 when Southend was just changing and setting up a stroke service. We've made fantastic progress since then. I was made lead stroke consultant 4 or 5 years ago now. We had the opportunity to move to the area which we didn't know before. We had young children at the time, and it's a fantastic place for them to grow up by the sea. They're having a really good time here. And now we are moving on to provide the hyperacute stroke unit services. The trust is investing a lot of resources in it, and it's fantastic to be part of such an exciting opportunity for treating patients with stroke in South Essex. Southend Hospital's a very friendly place to work. We have, in the stroke, we've won several national awards over the last few years, but it's only really possible because of the teamwork we've got with my other colleagues here. In particularly, stroke works very closely with radiology, who provide us a fantastic service with all different forms of imaging we need. We work very closely with our A&E colleagues and acute medicine colleagues, and I think that's part of the reason for our success. It's a very friendly place to work. People know each other, and it works very well. The secret to Southend's stroke success, I think personally, is very simple, because I think it's just doing the simple important things very, very well. I don't think it's anything special that we've got that anyone else in the country could replicate, but the really important thing is we've got people who are really dedicated in wanting to do their best and looking after the patients that we have. We, over the years, have been very supported by the patients and people in Southend. When I first arrived, they raised £1 million to give us a stroke unit we wanted to build rather than one we could afford, and because of that we've always felt very proud and very grateful for what they enabled us to get, and we've tried to go above and beyond to make sure they get a service that they and we can be proud of. On the back of that, the results speak for themselves. Since 2007 now, half the people die who previously would have died, and twice as many are independent, and a lot of that goes down to changes that have been made, different ways of working, and the expertise we've got in these specialist people who work in our stroke service. It's been recognised on a national level with multiple national awards that we've won, but the bottom line is simple: it's good people doing things properly and making sure that we do our best always for our patients. A hyperacute stroke unit is a stroke service that's responsive to patients in the instant that they have their stroke. It's very important there is a golden time where we can reverse the damage that the brain is going to have and stop the brain being damaged. If we can save damaged bits of brain, then people will have far less brain damage and they're far more likely to recover. Obviously that needs a very fast reactive response. That needs specialist input from consultants like myself, from the doctors and nurses in the stroke team, from our colleagues in the radiology department to get urgent scans without any delays, and also we have a neurointerventional radiologist who can, if required, perform a procedure where she goes up inside a blood vessel and pulls the clot out if drugs can't work. All of that is super specialised, but it can only work in a very short period of time, and that's why it's so important to concentrate the resources in a hyperacute stroke unit in order to prevent damage to people's brain and give them a much better outcome and a chance to carry on with their life which have been totally devastated by a terrible stroke. London and Manchester have got fully staffed, fully spec'd hyperacute stroke units after reconfiguration of services, which have shown dramatic outcomes in people getting better and not dying from their strokes. In Essex, things have been a little slower, but the trust has delivered a a large amount of money, which means that we are recruiting to be able to have a fully specified, fully organised stroke service like the ones in London, and it will be the first in Essex to be able to provide that. For patients, the rapid response in the specialist centre can literally for them make the difference between a life and death, or a life with terrible disability or no disability. So it's critically important that we develop these centres. They've been developed in London and Manchester, and already they lead the way in reducing disability and saving lives, and that's what we believe very strongly that the people in South Essex deserve. The patients, what it's all about, it's easy to remember some of the fantastic success stories we've had. With regarding the intravenous thrombolysis, which is the clot-busting drugs, there are many patients that I can think about. We have given it to over 700 people since 2007, which is probably one of the largest number in the UK. But the most recent patient that I remember vividly seeing it change her life is a lady who came in with a terrible stroke. She was unable to speak, she was unable to see on one side, she was unable to move on one side, and unfortunately she wasn't eligible for these clot-busting drugs. And so Professor Grunwald, who is our interventional neuroradiologist, did a procedure where she put a wire up the blood vessels inside the body up to the blood clot which was stuck in the brain, and managed to remove the blood clot from the inside, bring it all the way back out and restoring the blood flow. And that lady, within 15 minutes of the blood clot being removed, then sat up and shook her by the hand and said thank you to her, and walked out of hospital completely independent with no damage the next day. It would have completely shattered her and her family's life. Two patients who I remember very vividly from our early clot-busting drug days. In 2008 we had a young lady of only 21 who had a terrible stroke. It was a bit late that she was found, and she was able to speak and tell us what had happened. She was able to move on one side, and we organised MRI scans which confirmed that she was having a large clot and a very severe stroke, and it was one of our first cases of using the clot-busting drugs. This lady would have been terribly disabled. She would, I'm sure, have been ended up very disabled for her whole life, possibly needing fed through a tube if she was able to swallow. And yet within 24 hours of the drug, the clot had dissolved, and she'd made virtually a full recovery apart from a slightly weak leg, which then fully recovered. And since then she's gone on to go to university, to go abroad and live her life, which is the whole point of this. It's the way it should be. It's giving people their life back. Another lady I remember, because it was so distressing, was there was a lady who'd had a clot which went up the artery at the back of the brain, and she had the locked-in syndrome. She was able to blink her eyes, but she was unable to move her arms or her legs. She knew exactly what was going on, and she was crying, but she couldn't. She was completely paralysed and locked in her own body. And fortunately, by giving her the clot-busting drug and dissolving it, she unlocked and was left with just a small amount of double vision, which settled down, and she again got her life back from what would have been like living trapped in your own body in a living hell. These are miracles, to be honest. It's we call it the Lazarus effect, the first time we see someone make such a dramatic recovery. And that's why we're so passionate about developing these services, because there are so many people's lives which are destroyed by stroke, which we can make a difference to. We've had lots of people who've advanced their careers by spending some time working with us in our stroke unit. With regards to doctors, we have trained specialist registrars who are now working in other parts of the east of England as consultants in their own right. We've had junior doctors who've come to work with us who have gone into different fields, but who've become GPs, oncologists. It's a very good training in acute medicine and in areas of stroke, which is such a important thing for other areas of medicine to understand. And obviously it's such a big team we've got. We've got our nursing staff, our HCAs, our radiographers, our rehab staff, and there are opportunities for people to come in if they're more experienced and develop the service to make it even better, which is what I did when I joined as a consultant. Or we've got people who are qualifying, who want to start making their way and developing their career, and who will be able to have the opportunity to progress through the stroke service as they get more experience, or to start and then become take on other posts in their own right, developing their experience. It's a fantastic place to work. I look forward to working with you all. Over the next 5 years, I think there are various ways we want to improve Southend's hyperacute stroke unit. The key thing is making sure that we provide the best possible service to our patients in order to give them the best chance of making a full recovery from their stroke, which is part of the project which is ongoing at the moment, and why we're looking for people with passion to come and work with us. I think once we have this system in place, then it's building on the quality and services. We should share this nationally. We should share the good news stories. There is lots of things we should do. We already have a very active stroke research unit. We've been asked to provide around a quarter of all the stroke patients recruited into trials in the whole of the Thames region of the networks which we're in. And what I would like to do is develop us into a hyperacute stroke research centre, where we're at the forefront of delivering best stroke research in order to answer the questions we don't know the answers to provide evidence-based medicine to make our treatments even more effective. I think we should be developing our skills and ourselves to deliver better education to help other stroke units across the UK to be able to deliver the expert services that we've had and that we're developing. An example of this would be with the interventional stroke services, which I think there are multiple randomised controlled trials now showing that this clot retrieval thrombectomy is safe and effective. This is something which will become more widespread across the UK, and we'll need to train up experts to be able to do that. Professor Grunwald has the only simulator in the country which enables people to train on this without having to use this on patients to train, and this will mean that Southend is the forefront at delivering teaching. Now that could be the interventional side, or it can be the expertise of the nurses and the therapists in order to provide the best possible outcome for patients. There's lots we can do, and I think it very much depends on individuals' passion and what they want to deliver, and we will help them get there.